your research life. Okay? Not only just becoming a consultant, but it will help you all through your practice as a doctor or a researcher. So we're going to go, we'll start by, I just want to remove this. I don't know. So, so, so let's just go straight to the what we have for today, you know. I'm sorry, let me just sort out the technical issues here. So, foundations of research in medicine. So, we're going to talk about introduction to research in clinical medicine, the types of medical research you have, ethical considerations, choosing research topic, and then formulating research questions and objectives. I just want to be sure that you are hearing me.
Yes, you're allowed, sir.
Okay,
You're
fine.
allowed.
So, now what is clinical research? Now, by definition, we'll define a clinical study that is a study that involves people, individuals that volunteer to participate in a carefully coordinated studies. It's geared towards uncovering improvements and knowledge of screening, diagnosis, and prevention of disease, and also to promote health and healthcare. Now, it's a systematic process, which means that it's organized, of generating new knowledge and then validating existing practices and improve the patient care. So that's what could summarize as a clinical research. And that's what is needed for you. It's either to do your part one, also to go ahead to do your part two to become a consultant. And then also for your promotion to go into academics, you find out that you need a lot of clinical research. Now, it's organized and it's also systematic way of finding answers to what? To questions that are in health. Now, like it's organized and which means that it's well planned. And the systematic means that it has of steps of doing the things you want to do. Now, there are questions that are asked. So what are those questions? Those questions are gaps that you may need to fill. Now, those gaps eventually turn to become your research questions. And it should be a question that is relevant and useful. Now, remember, if there are no questions, of course, there won't be any answer. And then when you have answers, that's the end of the research. It could be positive or what? Negative. Now, so what are the objectives of health research? Now, we have a basic research gains, which is about gaining knowledge and then testing hypotheses and theories. Now, we also have implementation research, which is solving problems, including prevention, and then developing programs, policies to enhance development. Now, if you look at over the years globally, you find out that there have been a lot of benefits from clinical research. In the 1920s, we found out that rickets could be treated by just improving the nutrition of children. And then also, we found out that cigarette smoking in 1950 was linked to lung cancer. And then in the 80s, we now found out that folic acid could be used for the treatment of baby or mothers. You give it to mothers to prevent spinal bifida. And then in the 90s, we found out that combining antiretroviral drugs can help in treating HIV/AIDS. These are very huge benefits of clinical research. Middle income countries, most of them are not involved in research. So, but currently, we find out that current and future studies are focused towards getting effective treatment and vaccines for diseases like malaria, HIV, tuberculosis, neglected diseases such as dengue and leishmaniasis. Now, what is an alternative if we don't do research? So, be the alternative. Now, the alternative authority, my boss said, my chief said, oh, this is the way we do things, the tradition. Or common sense. Common sense tells you that a woman that have delivered 5 children will not have that, and all of them were complicated, were safe. Will not have complication in deceased pregnancy. That's common sense, but it's not common. We find out that the reverse may be the case. Now, personal experience, so over the years I have been practicing this way we have been doing it. You can find out um, it's not an alternative. We talk about evidence. That's what we use in medical practice these days. So you know, ask yourself, is it evidence-based? You find out that most of those methods, those alternatives are not evidence-based. Now you look at the difference between the clinical research and standard of care. You find out clinical research involves human volunteers. That may be patients or healthy individuals. So they mustn't be sick people before you can use them for research. Data through interviews, observation about a topic such as patient experience or disease management. Now, it measures the effect of over a period of time using robust and reliable methods to identify a lack of knowledge on issues such as cost, improved care. And then it may also involve comparison and control group depending on the type of research. Now, clinical research mainly focuses on the unknowns. So we want to find this thing that is not known, how do we get to find the answer to it? And then most of the time it sticks to protocol, there is no deviation. If you are doing a randomized control trial, find out that that's why you write your proposal and you must stick to the protocol of the research. Now, by comparison to standard of care, we find out that all about clinical judgment, about decision. So it's about maybe this is a way we have been doing things. It's not a research. So it's a standard of care, the best way of getting things done. Now, clinical research can be interventional or observational. Interventional means something is done. Observational means we are watching a group of people or somebody to know whether it's going to develop a characteristics and they use it for discussion. Now, observational studies are projects where there is no or no visible product assigned to patients. So nothing is given to patients. Example, how therapies work. You've given somebody paracetamol. They want to observe how the patient behaves and all that. Now, in health economic research, most of those, and then most of them are what qualitative research. They don't involve figures, such as the experience of patients after a given intervention, or maybe after living in an environment for a given period. Now, if you convert it to interventional studies, you find out that here, every participant is allocated to either treatment or control group at the start of the study. So while conducting this type of study, you already have in mind that something is going to be introduced. Now, if you look at WHO's International Clinical Trial Registry platform, you find out these groups of interventions are included. maybe using drugs, cells, biological products, surgical procedures, radiological procedures, devices, behavioral treatments, process of care changes, and then preventive. So all these things can form as interventions that can be given, and research can be converted to interventional study. Now, what is the process of health research? And if you look at this process that I have on this slide, you find out that when we compare questions and then the components in design, if you say, what is the problem? We are talking about the problem statement and justification. The number of women in Enugu, they are dying so quick. They are dying so, there are so many women dying in Enugu because of the fact they are having one breakdown. That's problem statement, okay? So what is the question we are trying to solve? Now we have to now define what? The research questions. Now, what do we know about this already? It means that we're talking about literature review. So you have to literature, search and know what has been known about dying in Enugu. Okay? How do we answer this question? Then it means I have to select a good study design. Now, what information do we need? So we have to select variables that we need to test. Okay? Now, what tools do we need? It means that we're talking about data collection techniques, depending on the type of study you want to study. Now, on the seventh question, where we collect this data? It means that you have to do sampling. So when you sample the community, you now know where you want to get your data from. Now, can the study harm any group to anyone? So it means that we're talking about ethical approval. So the ethical considerations, are they right? Now, how do we collect the data? It means you want to plan for data collection. Who, when, who is going to be used? Is there any pre-testing, or do we go directly to collect our study data? Now, what do we do with the data? So after collecting the data, what do we do? It means that we're supposed to process the data, analyze the data reports. Probably it now forms our dissertation and use it for exams, and then also have a feedback to the people that you collected the data from. So that's if you look at this study, it's just the health research in summary. Now, let's talk about more of the research. What are the types we know? We have quantitative. It means that involves numbers. What are the number of women that are getting pregnant? You count them, 1 to quantitative. What are the length of women? You measure their length, quantitative. Now, qualitative research means just interaction with participants by observation. Maybe you are watching women, that number of people that are going to come to the clinic to wash their hands. Okay? Observation. Or in-depth interview. You are interviewing a participant, asking the person what he knows about a particular topic until you can't get any other information from the patient. So these are qualitative studies. Now, qualitative studies are less popular in epidemiological studies in our setting. Most of the time, we find out that people that engage in qualitative research more, which they use informing policies, are usually the high-income countries. We are still battling with diseases here. Most of the times, we are talking about intervention here. What do we do to stop a disease? Now, qualitative research, they aim to what? To uncover the deeper meaning and significance of human behavior or experience. Now, used often when little is known about a topic. Why do patients jump? Why do patients run away from the words? So you may want to conduct a qualitative research, and if that want to interview so many people, want to interview the security men, the doctors, and after doing that, you may find this is the reason why people that are admitted in Parkland, why they run away. Okay, that's a qualitative study. Now it deals with issues that are difficult to quantify numerically. Example, beliefs. Meaning that there is no what? No hypothesis. So at the beginning of a qualitative research, no hypothesis. For example, if you are writing that as your dissertation, remember, you shouldn't put hypothesis there. Now, it's not interested in generalizing the results. So you want to find about a particular topic, what is known about this. Now, the researcher must be what? There. So you can conduct a qualitative research by proxy. So it must have to be there. doing your asking your questions. Now, sampling is not probability method. You will say sometimes when you sample one person, it leads you to the other until you finish your research. Now, there is a set number of participants, okay, or you continue to no new issues emerge. So you may continue asking the same question until you are no more getting new information on the topic you are discussing or you are trying to research on. Now, compare it with the quantitative research. Now, this involves numbers, numerical data. And then statistical calculations are done and conclusions are done based on our analysis and statistical calculations done. Now, sample based, so you must have a sample for you to do that. Now, the process involves, first of all, you may have a hypothesis. You make a prediction. Hypothesis is just making a prediction that if you use egg, if you are people that receive misoprostol, they are supposed to have less complications in labor compared to the women that are not needing, that don't need misoprostol. You can also say there is no difference between women that receive misoprostol at the end of normal vaginal birth compared to the one that receive. So that's a hypothesis. Now, the research is not proved that hypothesis to be true or false. Now, usually involves principle. There must be objectivity. So remove bias. In qualitative research, you can find out that you may decide, oh, I want to interview this person, I want to interview this person. So you now find out that you become choosy. Now, there must be validity, both internal and external. So the method must be reproducible. Now, representative sampling is key. So if you want to get a true story of this quantitative research, so you must make sure that all the people that are participating in the research, they are highly well represented. So now from this, we now go to what variables. I'm sure you must have been hearing about variables. Now, we have what we call dependent and independent variable. An independent variable doesn't depend on anything. So that's the predictor variable. So if you manipulate that variable, you now get the outcome variable. So when you start your research, you'll be hearing independent. So dependent is what? Outcome variable, what you are looking out for. And when you don't see that outcome variable, it depends on the predictor. Okay? Now, when it varies when the predictor variable is adjusted. So if you look at there's a research work that I participated in, magnitude and predictors of female domestic abuse in pregnancy in a patriarchal African society, a cross-sectional study of pregnant women in Enebe, Southeast Nigeria. So you find out that they will have dependent and independent variables. So now the outcome variable that we're looking for here, the female domestic abuse, who and who that's abused in their when they are pregnant. So that's the outcome. So what are the things that could tell us more? What are the things that we can vary to get this outcome variable? You talk about the age of the woman. Does it depend on the age of the woman? Does it depend on their educational status? Does it depend on their occupation? So those ones are the predictors. They are the predictor variables. So now if you look at it more closely, you can look at who and who ever abused. You can see that it is on the columns, while the independent or the predictor variables are on the rows. So you can see now, looking at that particular variable, you find out the age, predictor variable, the educational status was a predictor variable, and then whom employment status, they were all predicted. If you look at the values, you find out that they're all significant. There were many likely predictors that were assessed, but these three were chosen as the predictor variables for abuse during pregnancy. So from this, I'm sure now all of us now understand the difference between a predictor variable and an outcome. So you vary the predictor variable for you to get an outcome variable. Outcome variable is also dependent on the independent variable, which is the predictor variable. Okay. Now, so what are the different types of research design that we have? Now, looking at this particular slide, you see we have observational studies, designs, and also we have interventional. Now, and then the last is the systematic reviews. So now, observational studies, like we said, most of the time you observe. And they include what? Descriptive, or it could be descriptive, or it could also be analytical. Now, descriptive means that you're just describing a particular case. You have here it means experimental studies, like I said before. So an intervention is made, and one of the examples are what? Randomized control trials, before and after design. And then the highest point, you now see the systematic reviews, where you have a lot of, when you analyze a lot of research work on a particular topic. Now, let us start with the case study. Now, when you have extensive description of one particular report, you call it case report. So all they are writing is about an experience on a particular topic, or maybe you find out that there's a huge uterine fibroid coexisting with pregnancy, you want to write that. So that's a case report. Now, it could also be number of limited cases. Limited cases. It means that they can count the number of cases. For example, those ones are now called what we call case series. Now, there are different types of case series. You have small case series. When the number of studies is between 2 and 10 patients, so you could call that one small case series. So it could also be moderate case series, when the number of cases is between 10 and 50 patients, or it could be large case series when the number of participants is more than 50. Okay. Now, these case reports, they give detailed history of a single number of cases. So detailed history, this is what we saw. Okay. It's common in clinical medicine and then also social and health sciences. And then it's commonly, these are some of the issues to be reported when you have unexpected association between disease and symptom, unexpected events, that is observing treatments on a patient. Now, finding that shed new light on the possible pathogenesis of a disease or an adverse event. Now, unique or rare features of a disease. Now, unique or therapeutic approaches, or a positional or quantitative variation. So if you see an abnormal anatomical thing that you have never seen before and you want to report it, that's just all these are case reports, and usually they form the lowest point of evidence. So, like I said, use it to uncover unexpected effects which lead to increased knowledge. Okay. Now there's the lowest level of scientific evidence. So you find out that you can't compare it to, it's not vigorous at all. So now when you come up into the lecturer side, you find out when you make case report, it's one of the lowest scores that you get. So it's not as robust as other forms of studies. Now, some of the examples of case reports is the one we did in 2020, when we reported transmigration of forgotten surgical gauze spot that lasted for 5 years post-hysterectomy on a ground multipurpose. You can see now this is a surprising case. So we decided to report that. Now, another one is a placenta pracreta causing spontaneous uterine rupture. Placenta pracreta is when the placenta is morbidly adhered to the uterine wall, thereby perforating it when the woman was still pregnant. So we reported it in 2019. So whenever you see a surprising event or a case, it could be reported as a case report. I hope people are following my discussion, or do I have to stop?
We are following, sir.
Yes, sir.
Okay.
We are following.
Yes,
So
sir.
let's move forward. We now go over to cross-sectional surveys. Now, cross-section means you are making a slice at a given point in time. Now, you use to gather information from a specified number of cases, individuals or system in a population at a single point. Cross-sectional studies. You want to know the number of women that have women that take folic acid in antenatal period over when they are pregnant. So that's just cross-section. And then the factors that you are looking for is not expected to change. You don't expect that maybe by the time you come tomorrow, a new person has So it's expected that the factors should be uniform throughout the period of your data collection. So that's a cross-sectional study. It's relatively quick and easy. If you come to a college, most people do cross-sections because they can start the research today. Within 1 month, they are done and they are even published the research compared to other forms of research. And it doesn't allow you to now to check for cause and effects, which usually done by interventional studies. Now, if you look at these studies, evaluation of maternal preferences. So, maternal preferences is not supposed to change within the time the woman is pregnant. So that's a study we did in 2022. Now, awareness, acceptability, and uptake of cervical vaccination. Cervical cancer vaccination service among pregnant female secondary school teachers in Enugu. So we asked teachers in Enugu whether they have accessed cervical cancer vaccination. So we found out it won't change over, even if you're going to change, it's going to be very minimal. So that's a cross-sectional study once. Now you also have descriptive cross-sectional studies and analytical cross-sectional study. Here, descriptive means probably most of the time prevalence studies. Now, characteristics of interest are determined at a time. Now, it's just considered as a snapshot. Maybe you are just taking a snapshot or a slice through the population looking for particular characteristics. Okay, now, possible relationship between variables are studied. So this is why you now say the independent and dependent variable, they are related or they are not related. Now, the example are what the knowledge, attitude, and practice that we used to do when we were in medicine. So KAP studies, for example, this study by Dim et al. In 2010, labor support and overlooked maternal health need in Enugu. So it was a study that was done in Enugu here, trying to ask women whether they have labor support when they were in labor. So now, if you look at this table now, for you to conduct a cross-sectional study in a very simplest form, you have a population where you want to begin your study. So in that population, you must take a sample. Taking a sample, you want to determine who do you want to collect data from. So you collect data from all those participants at the same time. Now you know what you are looking for. What is the prevalence of labor support? Yes or no. So with that, you get your outcomes from two groups and determine your prevalence. Now, we have optional analytical cross-sectional study where feature have defined control. Now, it's still observational because you have exposure manipulation and participant assignments. Now, when you finish this study, you may get either odds ratio or relative risk. Let's look at those studies in detail. Now, you have cohort study. Now, this type of study design follows specific groups of people. So when you follow a specific group of people, those with a disease, with exposure to a treatment, and those and who are alike, but for a particular lifestyle. For example, when you talk about occupational diseases, people consuming alcohol and people that don't consume. So you follow those people over time to now see how outcomes differ on those two group of people. Now, it allows for collection of data over a given period of time, allows for interaction among with participants. So you can see that this is a very heavy study. You see a group of people that they almost similar the same. Some people is something, some other you follow them over time, know who is going to develop a disease or an outcome. So you identify groups exposed and done. So you don't follow them up for the outcome of interest. Now measure the incidence of the outcome over that time. Now you now compare the incidence in both the exposed and the unexposed. And when you do that, you now get what you call the relative ratio. So when you get the relative ratio, you now see that that's what you call a cohort study. Now, this particular study is always very expensive and takes a lot of time. Most people do not do this type of research. And you also know that it could be prospective or retrospective. Most of the time, the one we used to hear is prospective cohort study, but not the retrospective. Now, a cohort study, you identify a population, that's the beginning of your research. Now, when you now identify those people that are likewise be unexposed. For example, the effect of cigarette smoking on the incidence of lung cancer. So you see two groups of people that are smoking. You now follow them up for a very long time. And I'm sure by the time we do that, this study may even take up to 10, 20 years. And most of the times, people do not engage in this research, Now, we have another similar case controls. Now, here are matched to measure the impact of an intervention or disease. People with a specific disease or experiencing a specific intervention, the cases, are compared with individuals who do not have disease or have not experienced that intervention, who are now the controls. Now, once matched data is controlled from both groups, it is then compared to investigate whether the characteristics, example, nutrition, are different. Okay. Now, the aim of this is to try to uncover what caused the outcome in a group, but not the other. Okay. Now, to reduce the number of factors that could be related to the difference in the cases and control, all participants should be recruited from the same population. So now, if we want to check the effect of consumption of folic acid among pregnant women, or let me say the use of micronutrients on women that have preeclampsia. So we may identify women that have preeclampsia and the healthy pregnant women. And then you now want to now ask them, did they use folic acid when they were pregnant? So when you do that, it's a case control study because you have to identify the cases first. Now get a matching control and then look back and know whether what you are looking for has occurred on the patient or not. Now, you see that it examines possible relationship between exposure to a certain disease conditions. Now, identifying groups of cases, that's the individual cases with disease, and then also have the control of those people without diseases. Then you determine what proportion, that's the prevalence in the cases and the prevalence in the control. So when you compare the two, the relationship between the cases and the control is what you call the odd ratio. And define, you can see the other one, we're talking about relative risk. However, in the case control study, we're talking about the odd ratio. So case control studies, the subjects are prone to what? Recall bias. That's the major limitation for this type of study design. So if you're asking somebody whether whether you have been taking micronutrients, some of them will lie or they won't remember. So that may be a limitation. So even when you're writing the research, after writing that or micronutrients, one of the limitations of your study is always recall that this group of people may have remembered or they didn't remember during the research. Now, however, this particular research is relatively inexpensive because you're not going to start feeding those patients with folic acid and then looking at how they will develop over time. Now, it can be completed in a very short time and carried out by individuals and small groups of researchers. Okay, so it's cheaper compared to the cohort type of study. So here, the beginning is the population. Now, you look at people who has the disease, that's the cases, compared to those who doesn't have this, these are the control. Now, you now measure the exposure in each participant. You now see the people that are exposed, people that are not exposed. So when you compare this in the outcome, you now get your odds ratio. And that's what we call a case control study. So like I said here, you identify the cases, people that have a spinal bifida and babies that don't have a spinal bifida. So I'm not going to go others their behavior during pregnancy. You want to know whether they took their folic acid and how often they took it. So by the time you get this, that could serve as your case control. So now the last is the interventional studies. That's randomized control trials as an example. So now this is top on the hierarchy of research design. As a matter of fact, if you prepare for your part 2 exams and you go with a randomized control trial, most of the times you find out that that proposal will be accepted if it has a very good methodology. Now here, there must be what? An exposure or an intervention that is manipulated on the subjects of assignments. So, and then you now get your outcome. Now, so what are the strengths of this randomized control? Is accurate measurement of what? And there's randomization means that cases, before you now determine where somebody goes, not based on quota system, there are good randomization. People are using without knowing where somebody should belong, and then it's a reproducible result. Now, it has reproducible means that if you do the same research in Ghana, you get the same thing. So far, you measure, you follow the same methodology. Now, one of the limitations is that it's not possible in certain situations. Example, clinical trials and community-based trials, some of them, you may not really do randomization. You may determine the people want to give a particular intervention. Now, it's regarded as a gold standard for clinical research because, one, most of the time, see that bias is reduced. And sometimes you find out that for the fact that you have patients, most of the time are blinded, they don't know what they're receiving. So it reduces bias. And then it allows you to know the particular cause of a particular outcome. Now, we have different types of randomization depending on the design, the purpose, and then the method of randomization. And when you are writing your proposal, if you know, when you write this, you are meant to tell the person, tell the supervisor, this is the type of, I'm doing randomized control trial. I'm doing, this is the type of randomization I'm doing and all that. And the type of, is it a superiority design? Is it, you want to measure the same effects? You want to know whether it's a particular substance had the same effect as what is known before. So let's move forward. Now, you have a parallel group randomized control trial. Now, here, participants are randomly assigned to either one or more groups. Now, each group received the intervention. That's parallel. So one will receive the drug, the other one will receive placebo. Is the most common type of. Now, we have the crossover control, where participants receive multiple interventions sequentially with a wash out period in between. Now, what it means is that each participant serves as his own, at their own control, and then it's suitable for chronic stable conditions like hypertension. Now, another based on the number of interventions, also factorial randomized, where you have two tests. One, where you test two or more interventions simultaneously. For example, you have drug A, you give it to one group, drug B, you give it to another, and then combination of both A and B, and you give it to another group and all that. And then another group receive placebo. So this is commonly done if you go to labor ward, where a woman receives oxytocin, receives misoprostol at the same time. Another group receives only oxytocin, while other group were not given anything. So if there's ethical consideration has been found this research worthy, this would be one of them. It could be an example. So you also have cluster randomized control. So here, you are randomizing clusters. For example, hospitals, schools, communities, around instead of individuals. So, for example, you want to talk about primary schools. You now see primary schools that do hand washing and school feeding. You want to talk about primary schools that do school feeding and primary schools that don't do school feeding. So you have to randomize this into those schools, not really individuals. Now, the user is very useful in public health, like I said, maybe something like school feeding policy. You want to know whether it's effective or not, so you can use this. So you can also see research randomized control trial that tests efficacy. So you want to know whether a particular drug can work. So that's explanatory. So pragmatic, you want to check effectiveness of what has been in circulation. Now, based on randomization strategy, you also have simple randomization, where maybe on the toss of coin, somebody enters a particular, so participants entering a group is by chance. Or block randomization, which is the commonest one we usually do, where we have blocks of patients we randomize to each group. And most of the time, we find have equal number of groups in both the control and the cases. Okay, now we have stratified randomization. In order to ensure balance in both age and gender. So you may want to randomize based on this. Okay. Now we have some other forms of specialized randomized control trial, which I listed here. Okay, now in a simple form, randomization means seeing a population, that's the beginning of the research. You have one intervention, the one that doesn't have intervention, which is the control. Now, you randomly allocate your patients into these two groups. Now, each participant is followed up to see if they are going to develop it after an intervention. So an intervention is made, and then you now follow So the group that develops the outcome of interest is what you watch out for. So now, if you look at this post-part 2 work that was done by Ofo et al. Now, what did we study? We studied the effect of pentosins with rectal diclofenac. You can see combination of two drugs, pentosine plus versus pentosin for PAIF following this section is a randomized control. So you can see two people, a group was given two drugs, while the other group was not given drugs. And then they were now asked about their satisfaction and the level of pain they had following the section. So like I said, most of these studies, once they see that it's a randomized control trial, most of the time it is approved. I'm talking about for people that are in the O&G department. So usually it takes is of higher in the ranking than cross-sectional case control or cohort studies. Now we also have before and after study. Here, it means that there is an intervention. There's no control group. You use the same group. For example, you have a group of antenatal post women that came for immunization. You give them health education at the beginning of your intervention. Then after giving them health education, you now watch their behavior. How many of them is going to behave as they were educated? For example, if they were taught about cervical cancer screening, and after speaking to them on the reason why they should screen, then you want to now look at that, the same group of people, how many of them has now used the same intervention which you have given to them? So it could serve as before and after study. Okay. So like commonly used in management issues. So now the next step in the research design or the basics of is ethical considerations. So this is a very important topic in writing your paper or writing any research at all. So if you want to conduct any research, you must look about the ethical issues that are involved in the research you want to conduct. I hope I'm still being followed.
Yes, sir.
Okay.
Yes, sir.
Okay, fine.
Yes, Prof.
And I'm not only following me, I hope you understand what I'm discussing.
Yes.
Okay,
Yes,
fine.
sir.
So now we have talk about ethical considerations. Now, why do we talk about ethical consideration? Because we want to protect the dignity, the rights, and the welfare of the participants. Okay. Now, and this is to ensure that the research contributes positively to medical knowledge. Now, what are the key areas in ethical considerations? One is respect for person, that's autonomy. So what do you want to know about autonomy? Autonomy of patient means that participants must be treated autonomously, individually, with the right to make informed decisions about whether they participate or not. So if you're choosing a patient, because you're not participating in my study, I'm not going to see you first. I mean, you're already the denied patients of some of the services. So they must have autonomy. They have the right to participate in your study. Or even maybe they are participating in the study and halfway they choose to withdraw from the study. Now, there must be special protection is required for vulnerable groups, like children. They must be protected, because of fact they don't understand what you're doing. They must be, or pregnant women or prisoners. They don't have any option. You want to give them whatever you want. Or mentally impaired people, you can give them anything. So that's autonomy, key, respect for persons. Now, you also talk about informed consent in autonomy. Now, what is an informed consent? In the process by which individual freely confirms their willingness to participate in clinical research after having been informed of all parts of the study that are relevant to the individual decision to participate. So here, this is whenever you're writing research, if you want to publish more, they always about informed consent. Not only consent. If you write consent, they will tell you to go and organize it. And these days, not only informed consent, but there must be written informed consent. Okay? So written informed consent So let's look and see what it's telling us more. Now, researchers must provide clear, understandable information about the purpose of the study, the procedures involved, the risks and the potential benefits, and the right to withdraw without penalty. So this is what I have said before. So these are some of the things when you are conducting a research, if you want to take your informed consent, they will see you writing it in your proposal, mentioning some of these points I have highlighted there. Okay. Now, consent must be what? Voluntary. It mustn't be by coercion or undue influence. Madam, okay, since you're not participating in this research, don't worry. When you now see the patient, you won't give the patient any attention. You know, just focus on the people that are helping you. Okay. Now, informed consent is a most highly discussed and important element, particularly from an ethics perspective. Now, obtaining consent should be an ongoing process, not a single event, just by signing forms. So, if an informed consent doesn't stop on one day, especially when you are conducting your research over a period of, so I keep on telling you about. So you can also decide to withdraw that consent at any particular point in time. And I hope we do this when we conduct our researches. So you consider the perception of the community. It's also part of consent taking, approval by the community leaders. So you may want to go directly to the population. It may be difficult. So for example, go to a Muslim population, you want to give an intervention without going through their imams, see them first. It may be difficult for you. Or maybe you have a Catholic community. You want to know whether they will start using family planning without going through the Reverend Fathers. Of course, the research may be difficult for you to conduct. Now, the informed consent should be documented by means of a written, signed, and dated consent form. So after collecting your consent, it must be written and documented, and there should be date to it. Okay. Now, taking consent from a patient, now fully inform the patient of all that is applicable to the study. That's the purpose, duration, required procedure. Sometimes you see that we don't do this. We just enter the research. Over the time, patient will not be seeing new things you are supposed to do. If there are new things that are cropping up, new consent will be taken for those procedures. Now, be sensitive to the needs of individuals who are part of the vulnerable group, like children, like I mentioned before. Explain the benefits and the risks. They should be well spelled out. You cannot be hiding the risk of your research. If I give you this, you may develop cancer. You may develop cancer. So patients should know that following this research, I will not sleep at night. So it's not when the patient is not participating, it not be the hands of that. If the interaction when I mentioned study, of course you have to let the patient know. Now, patients should be encouraged to ask questions and give parents and additional information. So patients should be allowed to freely quiz you on the research, and then you also respond positively. Now, they ensure that the person understands that they can change their mind, like we said before, so they can withdraw without any negative consequences to them. Now, communicate using one simple, non-technical wording in the language the person will understand. Sometimes it may even be possible for you to write your consent, if you know, maybe you are going to a village community, they don't understand English. So how do you want them to read? So you find out that consent may be taken in Igbo. So you have to understand, make it so that in such a way that those clients will understand what you mean. Now, treat the recruits with utmost respect, even if they decline to participate. We've mentioned that before. Now, ethical considerations also involve looking at beneficence and malfeasance. So beneficence means maximal potential benefit to the patient and the site. So your research work should be geared towards giving benefit. And then there should be no harm. Risk should be minimized to the patient, especially intervention studies. Now, participants should not be exposed to unnecessary harm. We talked about it before. Now, carefully, you must explain the benefits and the risks. And usually, most of the time, when we look at ethical considerations of research, we must make sure that they balance risk and potential benefit. They balance before an approval could be given. Now, there should also be justice. First selection of patients. Randomized control trial, you find out there's first selection of patients, especially when you know that it could be beneficial. So randomization means random patients. So we'll say that people, let me select people that are community, let them get attention. So there should be first selection. Now, no group should be unfairly burdened with risk or excluded from the potential benefits. To say that, you should avoid exploiting vulnerable groups, especially people in low income settings. Now, there must be privacy and confidentiality, especially in data management. Now, data must be kept private, and the data must be used only for the purpose it was meant for. You find out some people, when they come from all those foreign research, they come here to take a blood sample. By the time it reaches over there, so many research could be conducted there, so it's not good. So you find out that the privacy and the confidentiality patient has given for the research has been broken. And we must secure storage method for our records, and then data must be anonymized. Be identified using their data. So that means anonymization of data. Now, so there must be independent ethical review of your research for it to be valid. So all studies must pass through reviewed and approved by an independent ethical or institutional review board. So before you send your research work for or proposal, so make sure that you get an ethical review approval. So, and most of the time when you don't get that, you find out your work will stop. This is not, if I conduct any research work without getting any approval. So if you have a topic and you have developed this, the first thing you also know, this research I want, can I get an ethical approval for it? Okay. Now, this ensures scientific validity and adherence to ethical method. So when you get an approval, it shows that there could be your research will become valid. So you also make sure that a part of the ethical consideration is the scientific. Is your research, is it scientifically valid? So poorly designed work. So when you are working, the result, you said that I want to give intervention of folic acid. So know whether women are going to come down with primary postpartum. You find out that the question you are asking is different from the outcome. So it may not be scientifically valid. Or how you want to get this? I want to know the effect of folic acid on the prevalence of personal bivita by doing a study. It may not work. Okay. Now, researchers must follow scientific principles. Most of the time, we're talking about the methodology of the research. Now, part of the ethical consideration, transparency and researcher must avoid fabrication. So when you are doing your research work, don't fabricate results. Now, some people also pressurize. They have seen what other people got, so they want to make their research to fit in. So it's not ethically right, and if you are caught, it will cause troubles, especially for people going for exams. Now, results must be reported honestly the way they are, whether the result is positive or negative. So we must have to report that. And then if you have complete conflict of interest, you must declare it. I'm doing this research because JSK is sponsoring me to Canada. That's why I did it. So you have to declare your whether you have conflict of interest or not. Especially when you are now making your manuscript, you're writing your manuscript for publication, find out conflict of interest must be declared. Even in your research work, you also have to declare conflict is one. Now, post-trial obligations. Now, participants should rise to effective intervention, especially identified. You find out that if folic acid to women, so you must make sure that the people that didn't receive. Okay, community should benefit from the knowledge gained. Sometimes when we have found out that there is a good knowledge, using insecticide-treated nets is beneficial in the prevention of malarial infection in the community. So what we have to do is that when we have finished our study, we have to make sure that we get back to the community so that they gain from the intervention and the outcome. Okay? So internationally, in international research, you have investigation, the investigator must avoid helicopter research, taking data without giving back to the community. After taking your data, they won't hear from you again. Okay, now also make sure that your research work adheres to international guidelines, declaration of thinking, Now you've been hearing the Helsinki. What is that? The research was approved by an appropriate research constituted review, and there's written informed consent that was taken from patients. Now, Belmont, all of them are talking about the same thing. So, in summary, for the ethical considerations in medical research revolves around protecting patient rights, ensuring fairness, and minimizing harm and maximum benefit to the patients, and then also maintaining transparency and integrity in the scientific research. Now we go to the other part of this discussion, choosing a research topic. Now, this is one of the most important steps in the research process. So if you are conducting research, this is one of the most important things. If you're not choosing your topic, of course, you don't have anything to study. Now it sets the foundation for a successful research. So if you have not picked a good topic, the research will not go on. So there are some considerations steps that are required in selecting a research topic. First of all, you choose a research topic. You have to talk about the area of interest. Okay? You are in community medicine. You are interested in maternal and child. However, you want to start doing health promotion research. It won't work for you because you may not have that interest. So you must be, so you don't have to go to that area of interest, which is maternal and child. Okay? Now, or maybe you are in obstetrics and gynecology. You want to go and study, you want to go to oncology. When your area of interest is in let me say infertility or fertility care. So you find that even when you are doing the study, you won't have that interest to move on with this research work. So you have to start from this. You are afraid of study, profession, or personal curiosity. Some things you want to find out by yourself, okay? Or things you enjoy reading, discussing, or working on. Yes. So if you like operating on women with cancer, you develop interest there, and then you go on with your research in that field. Now, choose an area you should be well motivated to explore deeply. So if you choose an area where you don't have good motivation, you may not, that motivation will not be there, okay? So you won't have that drive. So the next step is that, okay, you have to review the literature. For you to develop a good topic, you have to start reading wide. Now, what is known about, let me say, misoprostol use among pregnant women in Enugu? So you start reading what people have published in the past. And there are gaps they that you want to fill. So now you have to read recent articles, journals, books, all that. Or look out for gaps. When you after reading them, you may identify gaps or answer questions, which you think you will want to find a question. Now identify trending or emerging issues that are possible. Okay. So by the time you do that, you may develop a topic by just, okay, I'm interested in chemotherapy among pregnant women, or I want to know what's using carboplatin, comparing it with this. So you have to go and read a lot of books. You cannot just develop a topic by just thinking, because that thing you want to go and publish may have been done several times, and there may not be a need for you to replicate it, especially even when it has been conducted several times in your environment. So now in West African colleges, they say literature review is a detailed overview of research studies that have already been published on the subject with appropriate references. So that's what they wrote in your West African College of Surgeons proposal writing. Tables and figures are not included in. That's what they said. So when your research review, literature review, you tell it to us what they said in your proposal. So you have to go download the guidelines. How do they say I should do this? You go along that line. Now it should be well researched and reasonable length. So number of pages you should know the. And then when you have finished your literature review, now there must be what? Justification. Reason why the research should be considered. In short, after doing a very thorough literature review, you now see, oh, there's a gap or there is no gap. If you don't do a literature review, you may not see that gap. So, and that will now determine what you want to study. And that's how the research question comes in. So, ma'am, that's your topic. Must be relevant and significant. It must address a real problem that contributes to existing knowledge. So it's not something that is wasteful. No knowledge, no impactfulness. You go and start talking about it. You want to know about the, the use of whatever. So now practical importance to the community and policymakers. That thing you want to bring up, could it be used by the community's policymakers or professionals? Now, why does this study matter? That's the relevance, and to whom? Now, you also talk about the visibility of your research work. So you can see this thing is going to form the on the skin of women, and you don't know how it's not visible that you don't have materials that could be used to observe this, so it may be difficult for you in terms of timing, funding, equipment, or expertise that is required. So you must assess whether the research is visible or not, and ensure that data and study participants are accessible. Okay, or choose a scope that is too narrow or unmanageable, not too broad. So the visibility of your research topic is very important. Okay. Now, there must be clear defined objectives. Now, think about whether the topic can generate specific research questions or hypotheses. So, part of choosing a topic, this topic I want to choose, can I get specific objectives from? Can I get any researchable question from this? Okay. Then it should allow you to ensure that you compare and analyze variables systematically. Okay. So you have to align with your career and academic goals. I think we talked about this before. I want to be a renowned professor of oncology. So I'm going to start studying fetal maternal. So it has to be something where your future interest should be. And that may determine what you have to choose as your topic. So if you're not doing it early, you find out that immediately you become a consultant, it becomes easy for you to rise and become a professor. So I would start begging people for papers. Now, to also talk about ethical consideration. This topic I want to study now, can it get ethical approval? Okay, you want to now study the effect of, you want to compare oxytocin and misoprostol. Oxytocin is our baseline medication. You say you want to deny some women oxytocin because you want to study misoprostol. You may find that you'll be denied ethical approval. So it has to be important that you look at the research ethical consideration. So a research topic is chosen by balancing the research interest, the relevance, significance of the study, the visibility of how possible it is to consider that, to do that work, and then ethical soundness, while ensuring that it aligns with their research goals. So this is, in summary, that's what you needed for you to pick up a topic. I'm sure we are already thinking towards this, and sometimes you see people, let me finish my part 2 first before I will start talking about being choosy. Well, you may be fast enough choosing, but at the end of the day, when you come back, you find out that you have not moved a step. So the earlier you start developing interest in research and the direction you want to go is also good. Okay. Now, formulating research questions and objectives. So how do we get research questions and then objectives? I have to ask the question that the research will answer. So what is the question that this particular research? Because when you have a topic, there is a question that follows it. Now that research question should try not to have, it should not be so many. Maximum 4 questions per research, depending on the size of research anyway. But you can see that some research work that are really heavy may have different hypotheses. So those hypotheses will have different questions. Now, the aim and objectives are derived from the research question. I think I know that all of us are listening. That the aim and objectives are derived from what? Research question. So we should be seeing the mirror of your research question in your objectives. So that thing you ask as a question eventually becomes your specific objectives. Let's go down. Now, aim is the general statement that shows the the direction of the study and its contribution to knowledge. Sometimes you find out that the general aim is almost the topic of the study. Okay? Now, it should be sharp and focused. It should reflect the title of the study. You can see, that's what I said. So it's almost related to the study that's the study in general. That's most of the time the aim, the general aim. Now, encompasses the research question and then leads to what? Research objectives. So when you have found your aim, what answers the aim is then the research objectives. Now, those research objectives, specific objectives, are derivable from the questions you have asked. So, and if you do that, you find out that it's very easy objective from the question. We said that for you to ask a question, you must find a topic. And that type of topic, you have to research, do the research and then come up with a gap. Yes. You know, this gap, what is the prevalence of this following this? Now, what are the things I want to study here? 1, 2, 3, 4, 5 questions. Now, those questions eventually may reflect as specific objectives, while the general aim is related to the topic of the study. Okay. Now, it's linked directly to the aim, like I said. If you have an aim, what describe how to get that aim is the specific objective. It must be SMART. Means that it has to be simple, measurable, and then achievable. So it won't be thinking research that cannot be achievable. And it should also be reproducible and time-bound. Time-bound. You want to do a course study that will involve 25 years, and you finish it in 1 month. You can see that's not, it doesn't have a sound methodology, so it's not possible. Now, should not be too many. Sometimes you see people writing up to 7, 8 research specific objectives in one particular aim. So instead of that, you may split the aim into different, so you can see one body of work carrying so many different aims. And each aim will also have a sub-objective, like I said, minimum of 4. If you are going to 5, then it means that, yes, you are looking for trouble. So in conclusion, health research is the basis of what? Health knowledge. So, and it's planned. And remember, there is a need for you to have an ethical approval. So it could be qualitative research, it could be a quantitative research. Then there should be it follows rigorous steps and method. And sampling is usually necessary. Which group where they want to get, the people want to reach for research. Now, we didn't discuss sampling method, but probability sampling method is usually preferred to go to non-probability sampling method, especially for quantitative research. And then research methods are available for any research question, anything you want to. So based on the research question, we can choose a method. Now, if you choose one method, choose one method and it gives you the best answer to the question you have chosen. I'm sure that if we do this, it will be easy for us to go through the basics of research when we start writing our proposals and defending our dissertation. So my references. So I want to thank you for listening, and that will be time for us to ask questions. Thank you.
Wow. Thank you so much, sir. Thank you for that lucid and engaging lecture. It was quite long and to be covered under 1 hour, and you did a good job in 1 hour, 10 minutes. Thank you so much, sir.
Yeah.
I don't know if our participants have any question. I think it was clear, even though he was moving quite fast, but if there is any question, we have the next 5 to 10 minutes to take the questions. I call it a day. Questions are welcome. Anybody, you can unmute and speak, please, if you have a question.
I hope I will still have participants here. Maybe they understood all I said, or they didn't understand them at all.
It was well understood.
So we can go on interaction, and then if you find areas where you think it has been giving you difficulties in trying to conduct your research, I think this is an opportunity for us to talk about them.
Okay, so the room is open for anybody. Any question on research may not necessarily be pertaining to what was discussed today. Anything, any confusion on research, if you have any, that's what Prof is asking for.
I think most of them are sleeping. So you can unmute yourself and talk. That's what is a discussion. So,
Hello. Um,
I can't hear what you're saying now.
Hello, we
hello,
can't
hello,
hear you. Okay, we
hello,
can hear you. We can hear you now. You can
hello,
go
Prof.
ahead.
Thank you very much for the. Okay. All right. Thank you very much, Prof. Thank you very much, Prof, for the lecture, sir. Prof, I want to verify something about retrospective studies, where the participants are not handled, like getting data from records. Do we still need ethical clearance?
Yes, of course. When you want to handle people's data, those data are being kept there because they believe that the institution should be able to handle them. So you have to get an approval for you to use those secondary data. So you need an ethical approval. Yes.
All right.
I hope I've answered your question.
Thank you very much, sir.
Yeah.
Yes, Prof. Thank you very much, sir.
Yeah.
There's a question in the chat box, please. There's a question in the chat box.
Okay. Prof, can I read out the question or do you want to take
Yeah.
it?
Yes, you can.
Okay. The question said, can one who is in a private practice do researches? Where will he get the ethical clearance? Thank you, Prof.
Yes, somebody in a private practice can do, of course, you can do a clinical research. Now, for example, if you are depending on the population that you want to study. For example, you want to study the population of pregnant women in Enugu that are using insecticide treated nets. For you to do this study, you have to go to the Ministry of Health because they also have an institutional review board. And you get ethical approval. Once you are given ethical approval, you approach the places where you have sampled and you collect your data. So you mustn't belong to one institution for you to get in short, somebody in his house that is not even a private can also do research. I hope that the question has been answered. So you can comfortably do your research in Parkland, even though you are in a private setting. So what you needed, once you get that ethical approval to conduct the test, you approach your participants and you collect your data.
Thank you, Prof. Any more questions?
Yeah. Yes, I have one more question, sir.
Okay.
Prof, please, in observational studies where interventions are not introduced, can we use random sampling just to group the participants and it is still observational, just using random sampling to group the participants without introducing any intervention? Will it still be observational study, sir?
You can see when it's an interventional study, it's clear there must be an intervention that is given, whether it's health education, drugs, surgical procedures. That's when they now start talking about randomization. That's why they call it randomized control trial. You can't be doing randomized control trials with a cross-sectional research. Two of them are different. Do you understand what I'm saying? Or observational study. The observation is observing. You're observing, no intervention. Intervention means something has been given and you're watching out for the outcome. And usually for you to make sure that each group gets a given intervention, you now do randomization. And that's when we say that almost bias is eliminated by the time you do your randomization. So you cannot be doing a cross-sectional study. At the same time, you're also randomizing what are you randomizing? Okay, so I hope you understood what I said. Okay. Now, somebody said
Yes,
West
Prof. Thank you
African,
very much, sir.
yeah,
Thank you, sir.
West African College of Surgeons prefers prospective instead of, nobody talks about retrospective studies. Like, if you want to do retrospective and bring it you must tell me how robust that research is for it to be approved. In short, they prefer prospective interventional studies in O&G, obstetric and gynecology. They want to see an intervention given. So I think initially they added the PICO guideline. So when you look at that PICO guideline, you talk about patient intervention, the control, and then what you observe from the patients. So if you have interventional studies, they sell. Once you do interventional studies and there's good methodology, just forget that that exam will be so seamless and easy. But if you are doing cross-sectional studies, remember that the methodology must be robust, sampling must be good, and your method of data analysis must be fine. So, but like I said, interventional studies are the gold standard of clinical research. Okay. Do you have any other question? Are we going to call it a day? We will still be.
Thank you so much, Prof. Thank you for that presentation. I think it's very clear. It's clear enough. I want to use this opportunity to say thank you once again for availing us your time and taking the time to prepare the slides. We do not take that for granted. Thank you so much, sir. I don't know if the president of the association is here, so he can lend his voice to thanking the professor. Dr. Nayeligo, are you
Okay, yeah,
on?
I'm here. Yes, I hope I can be heard. Good evening, everyone. Good evening, my trainer and my consultants. Actually, I'm in Professor Enebe's unit, so good evening, my chief.
Thank you.
I wish to thank the committee. Dr. Gloria, you have actually done a very good job. This is the second series of this research methodology. The essence is just to help ourselves academically, because we are resident doctors in ALUTA issues. We should also empower ourselves. We are hoping that after this series, ARD ESUT-TH should be able and comfortably launch its journal club. So we thank our trainer here, Professor Enebe, for the training, for the lecture so far. I so much enjoyed it, and it cleared a lot of areas which I've been having issues in my proposal. So I think I'll have to go back and then fine tune those places. And I also want to believe that everyone that attended also is enriched this evening. So I want to thank those that attended. Please, we have more than 29 resident doctors in our association. Let us encourage everyone to come. This thing is part of is a core aspect of our training. Okay, probably because nobody is being charged for this. Maybe that's why this number is not there. So, okay, so on that note, I just want to thank you, everyone. And thank you, Prof, for.
Okay. Thank you so much. And the final notes. what I want to say is that we can continue to revisit this process of research methodology, because that's the basis of the research. If you understand the basics, honestly, you can go on with your research. So when you want to make your presentations, it will be seamless. You yourself will even know when you've done something that is not correct. If you say go and get ethical approval, you won't start quarreling with anybody. Or this has some ethical issues, you won't quarrel with anybody. So, and like I said, when we were residents, we didn't have opportunity of listening to people from a distance. So we have to travel to Lagos, Ibadan to go and listen to one topic and come back. And it was difficult, but now you can stay in the comfort of your house, keep on listening to this message over and over and over again. Of course, what you are going to be is that you are going to be the best in conducting your research and also going for your part 2. When you are going for your part 2 or you are defending your part 1 research work, it will be easy. You already know the different parts of the research work. When they ask you questions, you should be able to find easy answers to them. So I want to thank the ARD for, instituting this as part of the things you do for your people. And it's good. And it's going to help a lot of people. Those people that refuse to write their proposal, they should be coming for this. So that by the time we read it like first time, second time, third time, it must sink in. So thank you all.
All right, thank you very much, Prof. I want to use this opportunity to let everyone know that the research series continues next week, this same time, 5 p.m. on Mondays. So thank you very much.
Thank you very much.
Thank you. And then, good night, everyone.
Thank you, Prof.
Thank you very much, sir. Thank you, sir. Thank you, Prof.
Thank you, Prof.
Thank you.
Prof, mungo de sir.
Well done.
Okay, 68. You still take one.
Thank you very much. Thank you, sir. Thank you very much, Prof. Thank you.